Hi. Just imagine you're leaving Walmart late one night after a last minute school supply run for a project that's due tomorrow. Let's face it, we always procrastinate. And as you exit the building, you see a man laying in the middle of a parking lot. What do? Being able to assess a casualty is a skill set that is beneficial for everyone, and it can be done in just a few simple steps. You never know when you might encounter a non responsive person who could just use your help. Through my training in tactical combat casualty care and live tissue training in the United States Army, I've gained an excessive amount of knowledge of treating unresponsive people. The main point that I will be covering today are how to evaluate a situation and steps to assess the casualty's injuries. Please note, I will not be covering administering aid or treatment. If you are not trained, do not attempt to administer treatment or aid to someone, but assessing the situation is always a good thing to do, especially for medical personnel that arrive. You can go ahead and maybe cut a few steps off for them. I'm going to discuss how to evaluate a casualty. When you come across a situation of someone down, you need to assess the situation. First, you need to call 911, request medical assistance. On your way to the casualty, you need to decide if it is safe for you to approach them or not. You also need to decide if the casualty is at greater risk in the location they are in. If so, you should move their body. For example, if there's a wrecked car and the car is laying on its side and the casualty is next to the car, there's a risk of the car falling back onto the casualty and you if you approach and try to administer aid or treatment or assessing. In this situation, it will be better if you move the body to a safer location. If there is no imminent danger in the location they are in, it is always safe to leave the body where it is because moving it might cause more harm than good. Next, you will need to approach the body and assess their level of consciousness. Determining the level of consciousness of a casualty is important because if they are unconscious in shock, they can't tell you if they're in pain or what feels different. In the emergency medical procedures, the acronym AVPU is commonly used to aid in this process. First, firstresponse.org clearly outlines AVPU in the following manner. The AVPU scale is used to classify the patient's level of consciousness. A. Alert. The casualty is awake, aware of your presence and the environment around them. Their eyes may open spontaneously. They can have response to commands and will have some bodily motor functions. V. Verbal. The casualty will respond when spoken to. The response may be in the form of a voice, eye blinks, or motor responses in order to be acceptable. P is for pain. The casualty response to pain is stimulus. This is a very tested by squeezing the fingernails of the casualty, or using your knuckles, the more extreme measure, and rubbing the sternum of the casualty. Very painful. It is common practice that the casualty who is classified as anything other than alert will need professional medical evacuation and evaluation and your attention. Next, you will need to assess the casualty's breathing ability. Determining the casualty's ability to breathe, normally on their own, is a critical step in assessing their need for medical attention. Typically, the look, listen, and feel method is used to check for signs of breathing trouble. Place your ear close to the casualty's mouth. You want to look down at the chest toward the navel and watch the rise and fall of the casualty's chest, determining if both lungs are equally inflating with each breath. You want to listen for clear, smooth breaths, and you also want to feel the breath on your ear, determining the strength of lung capacity. If you look, listen, and feel technique shows unequal lung inflation, gargling sounds, or weak breaths, there's a breathing issue that requires medical attention. According to the Army Red Cross, checking for responsiveness and breathing should take no more than 5 to 10 seconds. Lastly, you will need to check the casualty for signs of bleeding or wounds. Being able to identify the signs of bleeding or wounds can help determine what type of injuries may be present and what type of first aid you need to administer if you are trained. Perform a blood sweep. Place your hands fingertip to fingertip behind the body of the casualty, moving in an inward and outward motion from the head to the feet of the casualty, looking for blood. Look for pools of blood which could indicate hemorrhaging. If the body is disoriented in an unnatural manner, there could be fractures. Do not attempt to move the limbs to place them back in the natural order, in the natural position. Now that we have discussed the basic assessment techniques for assessing a casualty, you should feel confident that you could inform medical personnel who arrive on the scene of your observations, or being to provide first aid should you be trained and eligible to do that. As I mentioned, being able to assess a casualty is a simple process and a beneficial skill set for everyone to have. To perform a basic assessment of casualty, you'll need to assess the situation, determine a level of consciousness, their ability to breathe, and look for signs of bleeding or other injuries. You never know when you can make a difference in someone's life by simply being informed.